Hi, I'm here today with Dr. Martin Milner. Thank you so much for being here with me today.
Thank you, Lily.
It's a pleasure to have you. Could you start by telling us a little bit about your education and background in cardiology?
Sure. I teach naturopathic cardiology at NCNM, National College of Natural Medicine in Portland, Oregon. I've taught it there for 25 years. And we teach cardiovascular pulmonary medicine, and I guest lecture in endocrinology there as well. And our clinic is about 2 miles from the Naturopathic Medical School, and I've been in practice in that facility that we built in 1991. We're having our 20th anniversary there in a couple of weeks. And we've evolved that clinic into being a teaching clinic, adjunct or satellite of the Naturopathic Medical School, where students, after they learn cardiology in the classroom with me, come and practice as interns, treating patients under my supervision and the supervision of one of our residents. So those interns gradually complete their term with us, become licensed physicians, then one of them becomes a resident who teaches the next group of interns, and we keep cycling trained naturopathic doctors with an emphasis in naturopathic cardiology. So it's pretty exciting.
Could you tell us a little bit about when you first started using L-arginine in your practice and what you saw with your patients?
Yeah, I started using L-arginine about 10, maybe 15 years ago. And in those days, our doses were much smaller, 1,500 milligrams to no more than 3,000 milligrams. And then the Nobel Prize was granted for the relationship between L-arginine and nitric oxide metabolism in the late 90s and into the early 2000s and mid-2000s. The dose protocols increased to 6,000 milligrams, rarely. And then there was kind of a hiatus in our clinical evolution with dosing of arginine. I would occasionally give doses up to 9,000 milligrams or 9 grams, and that was about as high as I ever went. Then I came upon the protocols and the exposure and the experience of ProArginine and the Synergy company using serving sizes of 5 grams each with a background of additional citrulline, which would increase the availability of arginine beyond that 5 gram serving size. And then watching people take 2 servings, 3 servings, 4 servings, 5 servings, 6 servings. So at 4 servings, you're at 20,000 milligrams or 20 grams of arginine with additional citrulline. And those are delivery systems and experiences that I knew nothing about before getting involved with Synergy. So it's a whole new vista of opportunity and studying how arginine at high doses improves nitric oxide metabolism and how that affects high blood pressure, coronary artery disease, even cardiac arrhythmia by improving circulation and blood supply, concepts of reversing plaque and arteriosclerotic disease, being able to document reversal of arteriosclerosis, and extraordinary possible vistas of research opportunity. We, about 2 years ago, implemented our own compounded bulk L-arginine, and it was fish-based, and it doesn't smell or taste very good. And when you mix it, you have to hide it in fruit juice, and it was the best available bulk powdered arginine we could find that was assayed and pure. But I'm here to tell you that just doesn't taste very good. So one of the challenges of taking high doses of arginine is being able to make it be palatable and be quality product and tested to be pure. And Synergy's product is rice-based, so the flavoring is totally different and much more palatable. It doesn't smell at all, and yet it's just as much arginine as the fish-based products were that we were using. And we still have patients that use that, but we're transferring most of our patient care over to this product because you just can't find another delivery system that gives high amounts of arginine with citrulline in a quality control environment that has bioidentical definitive levels of L-arginine in the product. So we're excited about it. It's a great quality product. Synergy does extraordinary jobs at self-manufacturing and quality control. They test over 160 components to make sure there's no toxicity in their product line. So they basically use pharmaceutical grade and beyond quality control standards, which is really unheard of in the dietary industry, in the nutraceutical industry. It just doesn't happen. And it's equally rare to find a company that self-manufactures and has control over the product from beginning to end, which is an extraordinary accomplishment.
Do you have any suggestions for people that are looking at incorporating Proarginine Plus into their supplements, where they might be under the care of a physician, and how they might talk to their physician about implementing this into their life?
Everyone who's thinking about talking to their primary care doctor or MD cardiologist should understand that they're very familiar with nitric oxide. Nitroglycerin that you put under your tongue when you're having angina, chest pain, and think you're having a heart attack is converted right into nitric oxide immediately. There are prescription drugs like isosorbide dinitrate and mononitrate that are nitrate prescription drugs that are not used for the treatment of anything other than unstable angina or chest pain at rest. That's when they're prescribed conventionally. That's their authorization genre, so to speak, for use. So if you explain nitric oxide to any physician, they're going to understand that. I would say 80% of the MD cardiologists know that L-arginine converts into nitric oxide, but they don't know much more than that, or how many milligrams to prescribe or use, and it's unknown territory for them. So anything that they're unsure about, especially at high doses, that they can't look up in their own resources and verify, they're going to be skeptical about. It's outside of their scope of practice and expertise. So they're not going to be comfortable authorizing something that they don't know enough about, that hasn't had controlled trials and clinical studies done on it. It's literally beyond their scope of practice and expertise. So the problem is you're asking the wrong doctor what his opinion is because he doesn't know. And if he or she were honest, he'd say, I really don't know enough about it. I need to research the safety and effectiveness of what you're considering doing, or I'll refer you to a naturopathic doctor or some other healthcare colleague of mine who maybe knows more than I do about this. But I'm uncomfortable as an MD cardiologist recommending this because I don't have any clinical experience with it. I can't find information specifically on this bulk powdered arginine product that has clinical trials. And that's just common sense, you know, kind of lay of the land, and it's reasonable and appropriate.
So some people, when they're looking at taking Proarginine Plus for the first time, some people are a little bit hesitant when they look at the price. Could you talk a little bit about the price of Proarginine Plus and maybe what some other alternatives are to working with a cardiovascular condition that they might be facing?
Right. Well, to be on a hefty dose of Proarginine Plus can cost $100 to $200 a month, depending upon how high the dose needs to be. And then that needs to translate to what medical conditions you're managing, and there's cost in dollars and there's cost in potential side effects from other therapies. Let's take, for example, high blood pressure. The good news in the prescription drug industry is there are a lot of $4 drugs for treating high blood pressure, beta blockers like atenolol, calcium channel blockers like diltiazem, lisinopril, and a lot of these other ACE inhibitors are $4 drugs now. So you can be on $3, $4 drugs for hypertension sometimes it's very well controlled. Sometimes it's moderately well controlled. Often you're getting either lethargy from the beta blocker, fatigue, problems concentrating, leg cramps from the calcium channel blocker, a dry cough from the ACE inhibitor. So you have side effect cost that you're compromising in order to get blood pressure control. And the drugs are directed to just control blood pressure. They're not directed to rehabilitate your circulation and open adhered endothelial cells and improve nutrition into your cells and remove waste products of metabolism, because they're not arginine converting into nitric oxide, which does all of that. So one of the great benefits of arginine is you're affecting multiple systems at once in a biologically therapeutic fashion that's almost hard to account for, because there are so many benefits that are happening simultaneously. So what ends up happening for a lot of people who take arginine is they feel better in more than just their blood pressure control. Their erectile function improves, their circulation improves, they lose a little bit of weight because they detoxify, their nutrition into their cells improves. So now $100 a month isn't sounding so bad, because you're not getting side effects on the one hand, and you're getting additional benefits beyond just blood pressure control. So it's a discussion that needs more sophistication than just talking about dollars and cents, because there's more cost involved with side effects and multiple additional systems being benefited. And that's common, but it's common in natural medicine for something that you do or take to have multiple areas that it benefits. But I have never seen anything that covers as much ground as arginine does, and how many beneficial systems are affected. I mean, you're breaking up glycosylated end products, you're opening up endothelial cells that are adhered, you're improving circulation to all the cells and tissues throughout the body, you're opening up blood vessels that have been shut down for a long time in certain systems. You can improve heart failure, kidney failure especially, because there's a tremendous amount of circulation in the kidneys. It's excellent for chronic lung disease because it opens up the epithelial lined surfaces of the lungs where oxygen is exchanged into the small capillaries, and there's more endothelial cells in and around the lungs than anywhere. So people with chronic lung disease that may also have high blood pressure end up having reductions in shortness of breath, and their blood pressure gets controlled. And what's going on here? How come I'm breathing better and less short of breath? I thought this is just going to open up my arteries and help my blood pressure, and yet it's helping multi-levels of systems simultaneously. So when it's all said and done, it's pretty much a slam dunk that if you have any of the conditions that arginine helps, you want to choose it first and prescription drugs last, even if they're $4 drugs, assuming you can afford it.
Dr. Milner, I just wanted to tell you thank you very much for spending the evening with me and talking to us about Arginine Plus. It's always a pleasure to listen to you talk.
Thanks. It's been my pleasure as well.
Thank you.